Now for the third stage of labor, so now we are at the level of the third stage of labor. Third stage of labor usually is going to be occur. It should be less than 30 minutes, but usually it takes less than 15 minutes. But when it is more than 30 minutes, an alarm. That's why third stage of labor is usually less than 30 minutes. Is it clear? And now in third stage of labor, we need to know that what if you are not capable of removing the placenta after 30 minutes, it's going to be called the placental retention. Is it clear? Or placental retention, placental tissue retention. Is it clear? So those are the different elements. Now, for the third stage of labor, you need to know that what in the third stage of labor, there are active management for the third stage of labor. Basically, there are different active management for the third stage of labor. The first thing is to inject an international unit of oxytocin intramuscularly. Basically, you inject an international unit of oxytocin intramuscularly, and you may add uterotonics. You may add uterotonics to prevent postpartum hemorrhage, provided the woman has the risk factors of postpartum hemorrhage that we are going to see in another tutorial. Basically, then the second one after that is to the first one even is to palpate the uterus to find if there is any other fetus. So you palpate the uterus to find for any other fetus. That's the first one. The second one now is inject 10 international unit of oxytocin intramuscularly, and you give also oxytotics or uterotonics provided the patient has a risk factor of postpartum hemorrhage. And you also catheterize the bladder in order to remove urine, because it's also another risk factor of postpartum hemorrhage. So now the third thing now after that is to do what? Is to now do so after that now you do you after clamping you do a control cord traction. So it depends on which technique you want to use. In the active management of third stage of labor, you can either use the Brown-Andrew technique, or you can use the credit technique. Is it clear? So there are two techniques that you can use when you want to do the active management of third stage of labor. You can either do the Brown-Andrew technique, or you can do the credit technique. Is it clear? So if you want to use the Brown-Andrew technique, the third element is going to be that what you do a control cord traction. Is it clear? You do a control cord traction. After clamping the cord, you do a control cord traction, and you do a uterine counter traction. Is it clear? You do a uterine counter traction, meaning that what? You mean that let's say that the uterus is as such here, and then you have the placenta inside. Is it clear? So before that even I've forgotten. So before going to the Brown-Andrew technique and all that, you must evaluate. So 1, 2, 3. The third element is to evaluate for signs of placental detachment. Evaluate for signs of placental detachment. The first is to palpate for the uterus to find any fetus. Second is to inject an international unit IM and give uterotonics to prevent postpartum hemorrhage and even catheterize the bladder. The third is to evaluate for the signs of placental detachment. Is it clear? You evaluate for signs of placental detachment. And what are the signs of placental detachment? The first sign of placental detachment is when you have elongation of the cord. Is it clear? The second sign of the placental detachment is when you have a globular uterus, and the third sign is when you have a sudden gush of blood. Is it clear? So those are the different signs. So you evaluate for the signs of the placental detachment, then you go now to the Brown-Andrew or the credit technique. For the Brown-Andrew technique, you do a control cord traction. Is it clear? And then you do a uterine counter traction. So I wanted to explain by using this diagram. So let's say that the placenta is here, and then you have the cord coming down here. Is it clear? So here is the pubic symphysis. Let's say that here is the pubic symphysis at this level. Is it clear? And this is the cord down. Is it clear? So you do a control. Let's say this is your forceps here. Is your forceps here. Is it clear? So you do a control contraction. You track here, and then you place your finger in such a way that it should be like this. Here is your thumb, and these are your other fingers here. Is it clear? You place your thumb here, and you place your other fingers here. So you hold in this way. Is it clear? And then you pull with your other finger down here. So that's why this is a control contraction. You pull the cord down, and then you place your finger to do a counter uterine uterine pressure. You do that counter uterine pressure in order to prevent uterine inversion. You prevent uterine inversion. Basically, and you do a control contraction in order to prevent also the disruption of the cord, which can result to a postpartum hemorrhage. So those are the two major complications that you have with the Brown angle technique. But the relevance of the Brown angle technique is that it's going to be more faster. It's going to be faster to deliver. It's a faster technique. Is it clear? Now, for the credit technique, is the slowest but the safest technique. The credit technique, but the Brown angle is faster, though it's still effective. So the credit technique, what do you do? In the case of a credit technique, you just massage at the level of the uterus. So when you're at the level of this uterus, just massage the top of the uterus, basically, and then you leave here. You don't tract at the level of the cord. Is it clear? So you just massage the uterus. So you place your fingers instead up here. Is it clear? And your thumb here. You massage at the top of the uterus. Is it clear? You massage the fundus of the uterus. You completely hold the fundus of the uterus in your hand. Is it clear? And you massage the fundus of the uterus. Is it clear? The drawback of this is that it's very slow. Is it clear? And you may even attain the 30 minutes of the placenta retention time. Is it clear? So it's very slow. Is it clear? So you massage the fundus of the uterus while evaluating for signs of the placenta detachment and all that. Is it clear? Now, after doing the control contraction, you sit down with all the placenta detachment. Now do so this is still 4. You now do the fifth element, or the active management of the third stage of labor. The fifth element, the active management of the third stage of labor, is now that you are going to wait for the placenta. Is it clear? You wait for the placenta, and then you roll the placenta. Is it clear? You roll the placenta either clockwise or anti-clockwise. Is it clear? You can roll the placenta either clockwise or anti-clockwise to deliver the placenta.